ages have great influence on society's ethics, especially when it comes to teenage girls. The increased focus is becoming on the body and its perfection. Cosmetic surgery has become a big part of everyday life for many Americans. According to a news report published by American Society of Plastic Surgery is on the rise for the second year in a row. Nearly 219,000 cosmetic surgery procedures were performed on people aged 13 to 19 years old. This constant obsession with appearance is outrageous. How young is too young? What would your stance be if you had a 15-year-old daughter wanting breast implants? Plastic surgery can lead to two major problems, biologically and psychologically. Non-medical cosmetic surgery is a growing problem in the United States. There is more than just bruising, swelling, and pain that follow cosmetic surgery. The emotional part of the procedure is just as bad. I would like to convince you that plastic surgery is for the mature only. First, plastic surgery is only for the mature. An article published in August 2012 by Catherine Hawthorne from the website Parenting Pink states that what a teen wants is not always what the same person as an adult wants, meaning that teenagers will sometimes make rash decisions. There is always going to be negative physical outcomes of any plastic surgery, but teenagers are growing and developing into young adults. Their personalities are changing, and their bodies are changing dramatically. Operations sometimes take 6 months to 1 year to fully recover. This is without guarantee of a successful operation. A teen must have a level-headed realization of the risks and conditions of plastic surgery. A research study done by Dr. Glatt and Dina Solomon, a psychologist with Mainline Today, explains their concerns for teenagers undergoing cosmetic surgery. Dr. Glatt says that the patient has to be mature enough to undergo cosmetic surgery. Psychologist Solomon explains that there is a misunderstanding of teen development. A girl's awareness of her body begins as early as toddlerhood. The way that somebody can criticize or critique her can harm her for the rest of her life, especially in her adolescent years. That is why teen cosmetic surgeries are on the rise. Solomon also expresses that parents need to talk to their teen, and they need to address the bigger issues in life. This will help teens become less urgent on going under the knife. Studies and statistics have confirmed that teens with low mental and physical psychology are not good candidates for plastic surgery. Plastic surgery is only for the mature. Teens also have to be biologically ready. And this brings me to my second point. A dependable article published in 2012 by Mainline Today interviews surgeons to see the risks of cosmetic surgery on teens. The first reason is that their body parts are not fully developed. Each body part in a teenager matures at a different rate, causing this to be at different ages for each teenager. An example is breast implants, the most common cosmetic surgery out of teens. The breast tissue is still growing at the age of 17, and a young girl could develop a fitting size for her without even undergoing cosmetic surgery. This would also reduce the risk of having silicone or a foreign object in her body. From the same article, Dr. Kirk Brando explains the long-term effects of implants. Whether breast implants or a facelift, having implants in your body is dangerous. Silicone leaks 20 to 30% in a lifetime. This means that silicone is free-floating in the body and in your bloodstream. Plastic surgery doesn't just harm a teen emotionally, but it can affect a teen physically, from health conditions to overgrowth and misdevelopment. Plastic surgery is biologically harmful. My last point describes what can be done to decrease teenagers' plastic surgery. A life coach, Ms. Campbell from EMAX Health, offers healthy alternatives for teen cosmetic surgery. Yes, teens are downright mean today, and bullying is a main issue in the United States. But there is so many alternatives to altering a teen's body. Ms. Campbell says teens should be aware of their self-image and have a positive outlook on life. This will be beneficial for the rest of their lives. She suggests forgetting Hollywood and becoming your own celebrity. Embracing your higher power. Putting yourself first. Being happy and remembering your values that you were taught in your younger years. These steps can make teens realize cosmetic surgery is not the only option to bullying, teasing, or low self-esteem. A study performed by Dr. Wallace and Dr. Stevens explains how parents can know if and when non-medical cosmetic surgery is appropriate for their teen. Dr. Stevens explains that parents are sometimes the problem. Parents push their kids to act or look a certain way. The parents have difficulty with their children, mostly their daughters, who don't look the same way as they want them to. Parents need to step back and realize that their teen is still growing, developing, and maturing into young adults, and they should seek other alternatives if the teen is feeling low self-esteem, being bullied, or teased. I hope I have clearly explained why plastic surgery for teenagers is wrong. In a statistical report, 219,000 plastic surgeries were performed on patients ages 13 to 19, ranging from nose jobs to laser skin resurfacing. Plastic surgery is both biologically and psychologically dangerous in males and females under the age of 20. There are so many different avenues to go down before considering cosmetic surgery as an option. After hearing my arguments, it should be clear that plastic surgery is only for the mature. Plastic surgery should not be performed on anyone whose body is still growing and developing. And lastly, the options that are available to teenagers coping with bullying, teasing, and low self-esteem are endless. Non-medical cosmetic surgery is a growing problem in the United States.